Welcome. This is Bridges Amuchi Bakochola.
Prison quality human
as we build a sustainable environment for growth. United by unique, one goal, many stories. Uniting efforts for inclusive cancer control is the theme, very apt for this year's World Cancer Day commemoration. Now, several countries around the world have been able to significantly increase their cancer survival rates by new and innovative ways to boost more survivors. Here at home, measures to create awareness, diagnostic support, access programs, health insurance coverages, screening support, and subsidization, as well as bank loans for cancer treatment too are in place. But do our people know? We need to get more knowledgeable of all these interventions, key into them to be able to boost more survivals. However, another major concern in the cancer space is children too suffer from cancers, and childhood cancers get less attention. Well, Bridges will be looking at this today. Welcome to Bridges. I'm Mujima Konjola, and with me is our newly crowned president of the Nigerian Cancer Society, Professor Abidemi Omonusi. On my extreme right here. Prof, you're welcome.
Thank you very much.
And congratulations.
Thank you.
We wish you a very successful and impactful tenure. And having driven in the last more than 3 years, ensuring that cancers in children are given the right perspective in terms of prevention, treatment, and of course, some palliative, is a young lady that has driven this so proudly. And we on Bridges are very proud because we've been tracking her, following what she's doing. Kemi Adekoye of Okapi Children Foundation is also here, and my extreme right here. Kemi, you're welcome on the program. And thank you so much for what you're doing with children with cancers. So that's the way we are today. We are going to be looking at we've reeled out a lot of interventions that are in place in Nigeria to ensure an increased survival rate. But we're still seeing more and more people coming down with cancers. Now, President, Nigerian Cancer Society, what are the new things that we must put in place as we try to build a bridge to contain and reduce mortality and morbidity around cancers?
Yeah, thank you very much for having me. Well, one major thing that actually caused the major setback, to the national effort is the gap between the rural community and the urban community. In the past, efforts have been galvanized, towards containing the disease, but more often than not, you find that in our urban centers, say Abuja, a lot of activity, Port Harcourt, Lagos. But what happened to the rural community? So that gap is there, and most Nigerians, reside in rural community, more than 70%. And I'm a pathologist, and what we see in the hospital is that most of the advanced cases of cancer that we see are from rural communities. So that information gap is there. Most of the misconceptions that people have, concerning cancer, whereas not in the city. People in the city are educated, there's a lot of information circulating in the media, but the major challenge is the rural community. That is one factor that is, causing a major setback. Then the intervention by the state government is not encouraging enough. Federal government has done a lot, in terms of policy, in terms of infrastructure, in terms of manpower, in terms of screening. But the major issue, there's a gap between the federal and the states.
And this gap we need to close.
We need to close.
Like yesterday.
Yeah, because most states in the country, apart from 5 to 6 states, majority of the states in the country has
Let,
no
let,
serious
let's
activity.
give credit to these states. Yeah, look, can you name them, please?
Yeah, number one, Katsina State, Katsina State, Ekiti State, Kebbi State, Kano, and Akwa Ibom, Yotre, try. So, Kala, Cross River, So, those states, they have program in place. They have cancer control. Yes, state cancer control program. They have Dex officer in Ministry of Health. They have oncology center. They carry on screening from time to time. They support oncology workforce. They have robust cancer registry. They have robust cancer registry. But many of those other states, in fact, I will mention them. There's a state in this country they don't have mammo. People have to move from that state to another state to assess screening procedure. They have no desk in their state Ministry of Health, to control no desk. Nobody shall with responsibility to monitor cancer incident, to even discuss the matter. That is the issue. So the gap between the federal, the state, and local government. For local government, particularly on cancer, in most local government, there's nothing happening at that level. So you see the gap, federal, state, local government, and state government. So we need to close that huge gap, if we win this war.
If we win this war. Kemi, you do a lot of outreaches concerning children. How serious is the case? How serious is the concern with children, unfortunately, living with cancers?
It is quite serious. We have done quite a number of community awareness exercises. And just 2 days ago, we were at Dutsipe community here in Abuja. Abuja, most people will tend to look at it as an urban city, but there are still some communities in Abuja that are considered rural. And at the community we were a few days ago to commemorate World Cancer Day, I would say 70% of the people that we met there did not even know childhood cancer existed. We had to sensitize them, we had to let them know, we had to show them pictures and videos. So we do need to do a lot more in terms of community outreaches and letting them know that childhood cancer is not a spiritual problem. It is a health issue that needs to be...
A lot of myth around it.
Exactly. It's a health issue that needs to be addressed accordingly.
In addressing it, what are your views? What should we do as a country, as a community, as an individual?
As a country, there needs to be more attention by the government. Like Mr. President said, federal government, state governments, there needs to be more attention paid to children battling cancer. There seems to be a lot of awareness and advocacy on breast cancer, cervical cancer, and other forms of adult cancer, but there's really not much going on. And as a people ourselves, we also need to be aware. Like when we take these community exercises down to the grassroots level, people need to come out and be aware. Sometimes it seems to be a problem if there's no freebie going on. People don't even want to hear about it. So we have also strategized and we tend to give back by doing free health screenings to attract people to come out and actually listen to what we have to say about childhood cancer, so that when a child has cancer, he's not constantly being treated for malaria or typhoid. He could actually go and get proper treatment.
Yeah, Doc, what are the warning signs, really? Well, particularly for children. Let's start from the very foundation, because those are the leaders who would emerge. So what are these things that viewers should watch out for, that you can help, you can assist and support to see that there's likelihood that this child is not well taken care of. Something. Cancer might, just
thank you very much, ma. Well, I concur with him. When it comes to childhood cancer, when people don't believe that children have cancer, I was recently discussing, I placed somebody in Abuja, let me not mention his name, and he said, do you mean that children have cancer? People that make policy for the country, that is the issue. People don't believe that children have cancer. So, and that's over the couple of years, children, childhood cancer have been neglected as a country. Our priority have been adult cancer. But recently there are several interventions by the federal government, to address that. Number one is establishment for the very first time, specialized childhood cancer registry in the country. Because as a country, we don't have data on childhood cancer. That is the truth, Until the coming of NICRAT, I must give kudos to Professor Suma Malami. He did very well. I was part of the team that assisted in setting up the first ever childhood specialized population cancer registry in Lut, Lagos, And I was there just last month, and we look at the preliminary data, the pattern has completely changed. If you go to literature now, they'll say the commonest cancer in Nigeria is bucket, and that was one published in the 80s and the 90s. But I look at their preliminary data, it has changed. It's no longer bucket. To tell you that we've actually missed it, because we've focused attention on the adults. I'm happy that the DG NICRAT is doing a lot to do that in conjunction with the Nigerian Cancer Society. Our plan is, to actually establish, one per each geopolitical zone. And discussion is ongoing now to establish one in Abuja. I must thank Okafor Foundation. She's the one driving that project, so that we'll have the second child. So data is very important, because that data, drives science, Say after God is data, If there's no data, what are we planning? So to address your question specifically, yeah, children have cancer, and that's why even at birth, there's what called congenital tumor. As baby is being delivered, they come down with cancer. Mostly due to genetic factors, have to do with their gene mutation, chromosomal issue during embryogenesis. That's why at birth we encourage that the baby should be properly examined. That is standard practice, because most people want to just deliver celebration. No, you celebrate, but the physician has to examine the baby thoroughly, because sometimes it may come down with growth. See the child with a big mass or lump, that lump must be examined. Or what you care, it may be a tumor. Or say a child with very protruding eyes. Both of the eyes are protruding, but something inside pushing out the eye. Or in the stomach, or the children is not urinating well, may have kidney problem. So growth is very important. Any part of the body where there's a lump, that must be properly examined. Then you find a child, developmental milestone is not picking up. As you monitor the child, the activity level is also reduced. You must suspect that there's something happening. So there are spots, there are certain organs, where we look, primarily, where this tumor is more common compared to others. Number one, the liver, the male liver, what we call it hepatoblastoma, the kidney also, even the eyes, retinoblastoma, the bucket that we know, they will have swelling of the jaw, very big, that's bucket lymphoma, And the one that is very common now among them is hematological malignancy, they're called leukemia, blood cancer, it's quite common among, children. So the children is anemic, completely pale, whitish, PCV low, so you must examine. So children have cancer, the reality is that, just the one we review in Lagos, the data, just within 1 year, almost 300 cases, in Lut, 300 cases, Children, yeah, childhood tumor, is 0 to 14.
Serious case here. So, can you share with us experiences out there? What do parents experience? What are the gaps? Why do they even bring, when you see a sick child, for example, why won't you present that child in good time? What are the gaps there?
Late presentation, I would say, is primarily due to financial circumstances. You have a family who can't even afford to feed regularly. They'd rather go to a chemist and buy paracetamol, buy some anti-malaria than actually go to the hospital. And that persists. Sometimes they tend to go into the spiritual realm. They tend to visit the pastors, imams, traditionalists, because it is cheaper for them and because they are not aware that there could be other cases apart from malaria. So that's part of what we do in terms of advocacy, to let them know that not every sickness is malaria, not every sickness is typhoid. You need to get properly checked, but there still needs to be a lot needs to be done. It's not, I don't believe, we are trying our best as a foundation, but I feel like a lot needs to be done. We need government support, we need interventions. The Nigerian Cancer Society has been particularly helpful, but we do need a lot more support in terms of creating more awareness for these children. There's too much spirituality when it comes to the health of children, and I believe it is largely due to financial circumstances.
You want to share, an experience with us, what you saw, and what intervention you made, and that has brought some measure of succor.
Okay, so I'll share an experience of our very first childhood cancer patient. His name, I don't know if I can mention his name. Okay, his name is Shitu. Okay, his name is Shitu Adewumi. And we met him just at the beginning of when we started the foundation. And he was taken to the hospital for leg pain. You know, his mother said he kept complaining of leg pain. He didn't want to go to school. So she assumed he was being truant. And she didn't take him into the hospital till maybe 6 months later. And at that time, he got to the hospital. Luckily, he was properly diagnosed, and he was diagnosed with leukemia. And I'd also share a bit of the personal struggles that these parents go through. At the time of the child's diagnosis, the father said, "We don't have cancer in our family. I don't think this is from my side of the family." It became an issue. The father left. The mother was left to struggle on her own with that child. She was a petty trader somewhere, you know, so she had to leave that job. Her mom had to step in to take care of her and the other children. She became a single mother battling a child with cancer. But to God be the glory, the child is fine today, and you know,
He's a survivor.
He's a survivor. He's back in school, and he's one of the beneficiaries of our scholarship scheme. We recently started a scholarship scheme for children with cancer, and he's doing very well now. Not all cases end happily. We do have some that are quite sad, but I believe if we have more intervention, more support, more parents going into hospital early, it would make a huge difference.
Yeah, when you say go to hospital early, I'll come back to our president here. Access to even, you know, for diagnosis. What's the state now? What should we as a country be doing? Thank God for NICRAT, but let's hear your views.
Yeah, access for cancer diagnosis is, I think, is improving. Again, must give kudos to the federal government. You know, you're aware that some centers actually upgraded. You know, we have 6 centers of excellence. You know, well equipped for cancer diagnosis and treatment. You know,
Is it free?
well, it's not free, but you know, those facilities are there. You know, the additional 6 is coming on board. But the major issue is the cost of diagnosis and treatment. You know, it's quite expensive and beyond the reach of most Nigerians. You know.
Even within the context of the cancer fund, how can this help, and how can any vulnerable person access it? For example, you are talking about the gap, you know, the urban and the rural area. How do you know? How can you access it? How much is it, for example?
The cancer health fund, a patient can access up to maximum 1 million. You know. But it's grossly inadequate because to diagnose, to manage and stabilize, you know, cancer patients, particularly breast cancer, patient will need an average of 20 million. You know, so in fact, the drugs now, you know, most of the drugs that a survivor take in a month, you know, they spend about 1.5 million. I had a meeting with some survivor yesterday, and one of them mentioned to me that she stopped using her drug 5 months ago. I said, why? I said she couldn't afford it. So, well, she gets.
What are the implications when you start and you can't continue?
Resistance is there, you know, and the tumor can come back. You know, she has been free before, and that's where to stabilize. If she now stop taking that drug, you know, she can have recurrence. That's the essence, you know. And then access to of those, you know, chemotherapy is also a major challenge now. As we speak, some of those drugs are in the country. You know, the NCAP, you know, couldn't access it because those drugs are not manufactured in Nigeria anyway. You know, they have to import them, and they are not. So there are a lot of issues, you know, concerning access, you know, both diagnostic and treatment. The bottom line is the cost. You know, most Nigerians cannot afford it.
So we're looking at the theme for this year, saying "United by Unique." I think very apt. So how united can we be? Because for us on International Society of Media and Public Health, this is what we can do, give public awareness. What can other people do beyond this? Because when you know it, even when you go for screening and some traces are found, so you now must go on treatment. What hope?
Yeah, United by Unique, that's the team, you know, just telling us that cancer survivors have different stories to share, and we've had that in the last 1 week, you know. But despite the fact that they have different stories, you know, we must team up together to fight this scourge. You know, it's everybody's responsibility. That's why the Nigerian Cancer Society is not a society for the medicals, you know. You know, you're a member, you know, media is there, you know, practitioner, policy maker. You know, we must unite, you know, to fight this disease. And that's a major problem that we have in this country before now. I must give kudos to the current Minister of State and the current Minister of Health, Professor Ali Pati. They've tried to bring all stakeholders together. Before now, we have government agencies, working across purposes, in addressing the issue. People working in silos, We are not united. There's no common front in addressing disease. But when the current minister came on board, he gave a directive that all government agencies that have one or two to do with cancer must unite. And that we saw happen, in this concluding Cancer Week. You see Federal Minister of Health, National Cancer Control Program, NICRA, working together with NCS, in implementing, what we have. So there's need for us to build a united front, against cancer. That's the only way we can win.
Kemi, I can see you're eager to jump on this. Yes.
I quite agree with what Mr. President has said. Anybody, I think all of us as individuals, we all have a story to tell regarding cancer, either as a patient, as an advocate, as a caregiver. We all have the same story to tell. A story of resilience, a story of strength, a story of hope, which is what unites us as individuals. So I believe this year's theme is quite an interesting, and it's very timely.
So let's build a sustainability bridge with the few minutes that we have. President, what would you be saying? What do our viewers need to know that this is a battle that calls on everybody to be at the forefront, to contain, to prevent, to help, to assist? What's
Number one, I want Nigerians to understand the fact that cancer really is not a death sentence. If discovered early, in our society, we have survival of 28 years and still counting, and what worked for her was, she found a lump and she went to the hospital early and was diagnosed. But, we're in a country where people are too over-religious. People have a lump in their breast. Instead of going to the hospital, they'll go to the mountain and pray. By the time they finish prayer and decide to come to the hospital, the tumor has advanced. So we must present ourselves early, and that is why any opportunity, for cancer screening, particularly people 40 and above, they should make themselves available for cancer screening. Because if detected early, the tumor will be, can be removed, and we have competent surgeons, we have oncology that can address that. But if the tumor is discovered, in an advanced stage, if you travel to Harvard, there's nothing they can do. And that's the problem that we have in this country. Majority of our cases are advanced cases. By the time you present the hospital, it's just palliative. And we just want the best.
With children?
I'm just going to buttress on what he said about presenting early. And like we also did agree earlier, it's also access to this care. Even if you present early, in some cases, you don't even have the funds to actually go through with that treatment. So there needs to be more support. There needs to be more government intervention. If a breast cancer survivor, for example, needs 20 million naira and can only access 1 million naira, what happens to the balance of 19 million? She'll probably give up. He or she will probably give up. So there needs to be more support for people battling cancer in general.
Individual responsibilities?
Individually, we need to take our health more seriously. We need to take our health more seriously. We need to imbibe a good health-seeking behavior. I was just saying before we started this program how I go for a breast scan almost every 6 months. I know it might be extreme, but because I'm in the cancer space, I tend to see it a lot. So I'm more conscious about this, which is where we need to get everybody at.
And then, yes, Mr. President.
Yes, I want to use the opportunity to appeal to federal government, and particularly the issue of National Cancer Aid Fund. 150 million budgeted for Nigeria in 2025 budget will go nowhere. And our position as the society, Nigerian society, is that we are appealing that amount should be increased to a minimum of 1 billion. I just want to appeal to the state governors, and the local government, because they are now autonomy, to show more commitment, in fighting this cancer in their various domains.
Thank you very much. Very, very important. As you see, is a united front that we need going forward to contain cancer in this country. And you can also do something. I know that in other climes, in other countries, when you even go to the supermarkets, you find some, little coin box donation where you can donate. Let's start that, But more than anything else, look out, speak about it, let people know. the president and of course the medical world has assured us that it does not have to be a death sentence, and it can only prove not to be a death sentence when you are the victim, or rather the person affected can present in good time. When cancer strikes in a family, it's not just about one person. It's the whole gamut of the family life and friends. And every day you receive calls, from everybody talking about how, asking for help. We can support when we create awareness for early detection so that more lives are saved. President, thank you very much. We'll
Thank
come
you very
back to
much.
you
Thank
again,
you
I'm
very
sure.
much.
Thank
you
you.
very
And Kemi, good
Thank you
work.
very much.
We'll come back to you again
Thank
because
you.
we need to track what some of the interventions that have been made to see how they're working. Until then, be a support system. Ensure that you build a bridge around containment and prevention of cancers. So we'll see you same time next week. Thanks for watching.